Hygiene and safety. It is important to follow some general hygiene and safety guidelines for your own protection and for the protection of others. However, it is also important to avoid actions that might compromise the test results through cross-contamination from sample to sample or from the environment to the samples. Perform the following steps in the same order to best protect the integrity of the testing. If you have long hair, tie it back off your face and away from your samples and equipment. Wear appropriate protective clothing such as a clean long-sleeved shirt or a clean dedicated coat. We also encourage the use of close-fitting safety glasses to protect your eyes. Then put on some gloves. Once you have put on your gloves, you should avoid touching unnecessary items. For example, don't touch your skin, hair, the chair, ground, or even door handles with your gloves. If anything drops on the ground, leave it there until the end of the testing. Clean gloves with an ethanol wipe and dispose of the ethanol wipe into a plastic bag. You could use an empty bread bag for this purpose. Wipe the bench area with an ethanol wipe before the testing. Also, wipe down the tube racks, the outside surface of the tip box, and the micropipette with ethanol wipes. Perform the testing following the test instructions. Refer to the accompanying video and written instructions for the testing. All used or contaminated tips should be disposed of into a disposal bottle with a lid that can be closed before disposing of the bottle into general rubbish bins. You could use an empty milk bottle for this purpose. At the end of the testing, dispose of the reagent tubes into the disposal bottle and close the lid of the bottle. You can also dispose of the sample tubes into the same bottle once you have your results and no longer need the samples. After testing is completed, wipe down the equipment and the bench area again with ethanol wipes before putting the equipment away. Dispose of your gloves into the plastic bag. Seal the bag either by tying a knot in the bag or using a rubber band before disposing into general rubbish bins. Chemical safety. There are no known hazards identified with the chemicals used in this kit. However, individuals can have varying sensitivities to different reagents, and while only very small quantities are supplied, care should always be taken to avoid exposure of skin and eyes to these chemicals. When storing the kit reagents, consider the location and manner of storage to ensure they are kept out of reach of children or other individuals who don't know how to handle them. If contact is made by kit reagents with skin or eyes, flush thoroughly with water. Handling samples. Sample tubes have the potential to cause cross-contamination between samples. The outside of the tube may have been contaminated with sample containing bacteria during collection, which can then contaminate gloved hands and/or equipment. It is recommended to handle samples in the following manner. Use a clean and dry sample tube rack. Before handling sample tubes, put on a fresh pair of gloves. Check the sample tube lid is closed firmly. Then mix the sample by swirling the tube strongly. Wipe the outside of the sample tube using an ethanol wipe to clean the exterior of the tube. And then guide the sample down into the bottom of the tube by gently tapping the tube on the bench. Then leave the sample tube to sit in the rack for at least 5 minutes before opening. Finally, change gloves before handling the next sample tube.